Hello and welcome everyone. I'm Dr. Sachin Kotastane from Lotus Medics. Let's talk today on a very important symptom called painful intercourse. Pain during or after sexual intercourse is a symptom that significantly affects not just the quality of life of the woman, but can also cause difficulty in achieving a pregnancy. It can be a source of frustration in trying to understand the cause of this pain, both for the woman and her partner, and can sometimes affect the relationship with the sexual partner. Today, let's discuss some common causes of painful sexual intercourse. Let's define some terms first. There's a few terms, first of which is called Dyspareunia. This comes from the Greek word dys, which means bad, and parunos, which means bedfellow. So basically, bad mating or pain during intercourse is called dyspareunia. This can be superficial, which is usually on the entry, and often women describe this as a razor wire rubbing on the vagina. The most common cause of this is vaginal dryness or change in vaginal pH. This can sometimes happen due to scarification at the vagina due to previous perineal scars, or due to local vaginal or vulval infections or chronic conditions like lichen sclerosis. The other type of dyspareunia or sexual pain is deep dyspareunia. This happens on deep penetration and can also happen after intercourse. Often women will have a deep-seated pain, especially in their abdomen or pelvis. This happens due to deep-seated conditions like severe deep infiltrating endometriosis, adenomyosis, or fibroids, or sometimes can even happen commonly when the uterus falls back over itself, a condition called retroverted uterus. Let's understand another condition. This is called vaginismus, and essentially this is involuntary contraction of the pelvic floor muscles in anticipation of pelvic pain. The common causes for this may be a previous unpleasant sexual encounter, conditions like endometriosis which have caused chronic repetitive pain over a period of time, history of sexual abuse, persistent pelvic pain, and central sensitization of the pelvic floor muscles. Sometimes during vaginismus it becomes impossible to contemplate even inserting a tampon vaginally. Often in this situation, cervical examinations, especially cervical smears, become very excruciatingly painful and intolerable. The main and the most important message I want to give all the women is don't ignore this. This is not something that's happening in your head. This is not something you're inventing, and this is certainly not something that you should blame yourself for. This needs a comprehensive assessment and a holistic and a multidisciplinary management. The first step we do at Lotus Medics is we have a detailed conversation and we listen to you. We try and understand the cause of the pain and where this pain might be originating. This may be followed by a careful and a very gentle examination to ascertain where the problem is. This is often done with the most and utmost gentleness, as minimally invasively as possible, to extract as much information as possible, but as far as possible avoiding or minimizing any pain or discomfort to you. We may also need to organize an ultrasound scan to check for any fibroids or endometriosis or any pelvic masses, and we may need other tests like vaginal swabs to check for any infection or any pH changes. Let us come to treatment. The treatment is generally tailored to the cause. For example, if there's lack of estrogen, giving estrogen vaginally can usually correct this. And this restores the vaginal pH and improves estrogenization, thus improving symptoms of superficial dyspareunia. Where there are endometriosis and fibroids, these may require discussion of treatment strategies which range from medical to surgical intervention. We may also refer you to one of our multidisciplinary colleagues like a pelvic floor physiotherapist, and this may be required in conditions where there are pelvic floor spasms or pelvic floor hypertonicity. Sexual rehabilitation is a big part of menopause management, and we offer tailored, customized solutions to women in menopause suffering from female sexual dysfunction. In severe cases of vaginismus, where all conservative management has failed, we know that pelvic floor Botox has improved outcomes in certain select cases. We use a whole host of other multidisciplinary, holistic management options and work with different specialists to improve the quality of your life. At Lotus Medics, we understand the impact that sexual function can make to a relationship, and we always strive to improve the quality of your life and the quality of your sexual function, which also improves the quality of your relationship. Thank you for listening. This is Dr. Sachin Kurustani signing off for today. I hope you've enjoyed our video. If you have any questions or concerns or anything that you would like any consultation on, please do not hesitate to contact us on 1-300-356-887 or email us at admin@lotusmedics.com.au. Thank you.